Hey everyone, it's Crystal here in the AAFE Training Center, and today I am doing a lip enhancement on one of my beautiful patients. So this is actually the second time that she has gotten her lips done, and she always likes to leave them really nice and natural, just a little bit of plump, nothing too crazy. As you can see, she has a really pretty shape to her lips already, so it makes my job very easy because I just have to kind of fill in her natural shape and just give it a little bit more volume. So I am using a medium light filler, which is one of my favorites that I use all the time, especially on patients who want a more natural look. This product injects really nicely through the syringe. It's really easy to massage, really doesn't offer, a ton of lumps and bumps like other products. And I personally find that it doesn't swell as much. So I think it looks really natural in the lip, and a lot of my patients really love it. So as you can see, I'm not injecting through the syringe that the filler comes in. I actually backfilled the filler into a 0.5 cc ComfortTalk syringe. So this is actually the same syringe that I use when I inject neurotoxin, but I'm using it to inject filler. And I've really started doing this over really like the past year. I've been doing this for a lot of patients because I find I have way more control over the filler. And you can be super precise with where you put the filler. So obviously it's being injected through a 31 gauge needle. So you're injecting way less filler with every injection than you would with the actual needle and syringe of the filler that it comes in. So I just like it. I also really like that the needle is smaller, so it helps with keeping the patient more comfortable. So in our practice, we typically only numb patients with a topical anesthetic, and our patients normally do really well with just the topical. So this is just an extra little step in helping patients to ensure that they're as comfortable as possible during a procedure that is known for not being very comfortable. So, this patient obviously has had her lips done before, so she kind of knows the drill, knows what to expect, and you can tell she's doing a really good job. I am using just like a standard volume technique on this patient. As you can see, I'm kind of doing like a right angle technique here, but as opposed from coming in through the vermilion border, I'm going up into the Cupid's bow just to give her a little bit more of a peek. And the reason for this is because I don't love to use the right angle technique every single time I do someone's lips. Every time you kind of break through that vermilion border and open up those tiny little channels, over time it can allow the filler to migrate out of the lip and cause just a not very aesthetically pleasing outcome or result. So the first time I did her lips, I did right angle across the top and bottom just to give her more height, more show, and more room for me to work with. This time I'm doing mostly standard volume to maintain the shape she already has, but just give her some more plumpness, more volume. So as you can see that her left Cupid's bow really just wasn't peeking up like I wanted it to. So you'll see here that once I kind of get filler everywhere, I always mold and massage. And then I have the patient sit up and I'll look really closely. I'll have her smile, I'll have her talk so that I can see where I want to perfect the lip and make it as symmetrical as possible. So after I mold here, I will do that. And then I found that I didn't really like this peak. It still wasn't as peaked up as the other side. So this is the only area that I did do actual right angle on and go through the vermilion border to ensure that her Cupid's bows were very even and symmetrical. So once we are all done here, you can see I'm just getting her nice and clean. And then I'm using the ComfortTalks Post Care Lip Kit. This is the serum first and then the balm on top. This is an amazing product that helps with bruising and swelling because it's loaded with arnica, and it's a brand new product the patient gets to take home to continue using over the next week or so. So that is about it for this patient, and thank you so much for watching, everybody.